Hello and welcome back to my channel. I'm Miss Key and we're going to finish our conversation that we had on our previous video. And if you haven't seen that yet, please go to it. Feel free to subscribe to our channel. Keep in mind that I'm going to continue the subject matter when we're demonstrating skills for infant CPR. So with that said, I'm gonna give you a scenario for a one-person rescue infant that feel free to use it. Create your own. You are aware that in your BLS manuals, and I'm talking to instructors, that you can pick scenarios that they actually give you. But my scenario, I like it because it taps into some things that people may miss in the video. With that said, here it is. So you're watching this infant and you're all alone. And by the way, you do not have your cell phone. And the infant wasn't feeling very well. So when you go check on that little one, you notice that their color doesn't look too good. So we're going to do that tap. Baby, baby, are you okay? Are you okay? Checking that brachial pulse from your side. No reach overs. 5 no more than 10 seconds. This infant is unresponsive. Immediately, I'm going into that high quality CPR, placing my fingers slightly below the nipple line. I'm going to compress at a rate of 100 to 120 compressions per minute. At this time, you can share with your students they can use 2 fingers or the 2-thumb and circular hand technique, where you support the infant's back with your fingers and compress with your thumb. I'm going to compress at a rate, again, of 100 to 120 compressions per minute, allowing that chest to completely recool between compressions so the heart can fill up with blood needed for the vital organs. After my 30 chest compressions, I'll perform that head tilt chin up, not overextending the infant's head. Just like bending a straw, you can actually cut off the airway. Covering that infant's nose and mouth with my mouth to give a rescue breath, but not an excessive breath. After watching the chest rise twice, immediately I'm going back into my chest compressions. I will perform 5 cycles or 2 minutes of CPR, and then I'm taking the infant with me to the phone to dial 911 and answer all the dispatcher's questions. Keep in mind, the reason why I share that scenario is because we are aware if we find an infant or a child unresponsive, we have no one to tell or call. We want to perform 5 cycles or 2 minutes of CPR first before dialing 911. The reason why, typically we know with infants and children it may be some type of respiratory issue, and if it's us, it may be some type of cardiac. So if I found an adult unresponsive, have no one to tell, don't have my cell phone, I'm going to leave them go dial 911, find the AED, and come back. So you can use whatever scenario you would like. Make sure that your students are counting out loud, and you tell them you want them to count out loud so if someone else arrives they know where you are in your count, especially if first responders arrive. So this was Key with another tip and message for infant CPR. The next video we will have will be a demonstration with a 2-person rescue and how I would like to see things done if I'm monitoring your class. Have a good one.